Okay, we are all ready to go. So again, welcome everyone to the talk on new and novel pelvic health physiotherapy treatments. And this is an exciting one for me because there are a lot of new things coming and also some new evidence to support some treatments we've already been using. So if I go a little bit quickly over this is information on the pelvic floor muscle. So in men, women, children, we all have a pelvic floor. This happens to be showing a woman because of the uterus here. But that pelvic floor muscle is a muscle that runs from the pubic bone, sweeping back to the tailbone, and supporting these three organs, the bladder, the uterus, and the colon. If we take a top-down view, we can see how it's so appropriately named the pelvic floor, because it really does form the floor of this bony pelvis. And in that way, it connects to lots of the bony structure of the pelvis itself. So if we look here, it attaches to the tailbone or coccyx and all the way back along the sacrum, along the pelvic outlet, and right at the front in the pubic symphysis. So if we're looking straight down from front to back, we can see the urethra where urine comes out from the bladder, the vaginal canal, and the anal canal. So this is just one last picture. So this is showing the opposite view, so not top down, but from the bottom up. So this would be a female again, because we have vaginal canal and anal canal. And can I just ask everyone that's on the call just to mute during this portion of the talk? That would be amazing. Okay. And what does that pelvic floor do? So as a pelvic health physiotherapist, we spend a lot of time talking to our clients about what actually is down there and what it does. And one of the things that we as pelvic health physiotherapists do with the consent of our clients is do an internal exam. So I'm trained as a general physiotherapist, like all my colleagues, but then have gone back and done additional courses in order to have that skill, the piece of doing the internal assessments. It isn't mandatory, and certainly if you said, this is not something that I'm comfortable with, or I have an infection or anything like that at this time and do not want to proceed, then we certainly do not. But it is the one way that we can judge what is happening with that pelvic floor muscle in terms of its strength, its endurance, its integrity, and many other things. So when we think about what the pelvic floor does, it does many things, but the three biggest functions, it has this lovely support function. So it supports the bony pelvis as a whole, as well as supporting the three pelvic organs. So it supports the bladder, the uterus, and the rectum in females, and in males, just the bladder and the rectum. It also has these sphincters that allow us to pee, so to get rid of urine, as well as to poop, to get rid of feces and gas. And we do want both of those sphincters or clamps to work very well, so that we don't leak any of those things when we don't want to. And last but certainly not least is that the pelvic floor has a sexual function in men and women, and that quick rhythmic contraction of the pelvic floor helps with orgasms. It also is one of the things in men that helps with erectile function. So we want a pelvic floor that both lengthens appropriately, but also contracts appropriately, and then it helps with all of those functions: the support, the sphincter, and the sexual function. So when we divvy that up a little bit, if we start with the sexual function, some of our clients have something called dyspareunia, which is simply pain with sex. And those are clients, they may have, they may be young, and have never had children if they're women, or they may be in the postnatal period or later in the menopausal period as well. Vulvodynia, so pain and kind of inflammation in the vulvar area. So we certainly see women like this and sometimes it's, women have had an infection and it's been painful. And even after the infection goes away, there's still pain and hypersensitivity and they can't figure out what's going on. And unfortunately, many of these women go to doctors, and occasionally, I think it is definitely getting better now, but occasionally doctors say, I think it's in your head. We're going to try another steroid cream or something like that. And it may not be the tissue itself, but the muscle underneath has become a bit overactive, which we'll talk about a little while later. And that overactivity contributes to pain. Okay. We also, as I mentioned, erectile dysfunction is one of the other things that can occur if the pelvic floor is not working well. And in men, we want that pelvic floor to contract well and fully, and that helps to keep blood within the erectile tissue, and that helps support an orgasm. In its support role, the pelvic floor helps prevent pelvic organ prolapse. It's one of the structures that helps. There are many others, including ligaments, fascia, and a few other things. It helps with pubic symphysis dysfunction, and it helps with core instability. In its sphincter function, the pelvic floor helps prevent against urinary incontinence and fecal incontinence. So while I think people are getting a bit more comfortable saying, I leak pee and I don't want to, and seeking us out, which is great. Just saying that you have any kind of leakage from the back passage is harder to say. And I do want everyone to know we see lots of clients like that, and there's lots that can be done, and it really has a big impact. And last, if the external anal sphincter, that opening on the back passage, is not working very well or is overactive, then we can develop constipation. And certainly I see that in adults, but I see that a lot in kids. And that's an area that, is growing in the practice, is children with constipation and potentially fecal incontinence. I'm going to come back to this in just 1 second and just ask if anybody have any questions at this point. I don't see anything in the chat function. We're all good. Okay, so that is kind of the primary roles of the pelvic floor. Now what I'm going to dive into is a discussion about kind of 2 different ways that the pelvic floor can go. And we see that in our practice every day. And that is, I'll start out with the one most people understand a little bit better and are more aware of, and that's pelvic floor weakness. So we have many, many clients that come through our doors that say, I have an issue. I just need to do my Kegels, and I need to strengthen my pelvic floor because it's weak. But what I will tell you as a pelvic floor physiotherapist is that's not always the case. We have weakness sometimes, and a lot of times we have pelvic floor overactivity. I'll discuss that a little bit more later, but I'll start with the pelvic floor weakness end of it, and then talk about some treatments that we can do for that. Okay. So if we have pelvic floor weakness, what we sometimes see is that we have urinary incontinence, fecal incontinence, as well as pelvic organ prolapse, as well as sometimes just a lack of sensation. And you can imagine that. I mean, if you have, let's envision a hammock, okay? You've got this hammock, you get it this summer, It's brand new. All the fibers of that hammock are really strong. They haven't been damaged by the sun or by the weather conditions. And so you sit in it and it holds your weight. Then fast forward 5 years later, and you've left it out every summer for 5 years, and it's been weakened. The fibers now have pulled apart, and the hammock drops down. So that hammock is synonymous with the pelvic floor. And now what's sitting on it are those pelvic organs. So your bladder, your uterus, and your rectum. And now in that dropping down, the pelvic organs start to prolapse. That's all that prolapse is dropping down. And we'll go into some treatments for that as well. And then the last is lack of sensation. So if we have less integrity of the pelvic floor, lots of times we have a little bit more space or room within the vaginal canal. And then we have a decline in sensation. So what can we do for that? Well, actually, let's talk about why it happens in the first place. So the pelvic floor becomes weakened by a number of different things. Certainly pregnancy is one of those things. So just thinking about the pressure that is put on the pelvic floor for 9 months, and the number of times that you do that continues to put stress through the pelvic floor. And then if you go on to have a vaginal birth, that childbirth in itself puts lots of pressure on the pelvic floor. In fact, we know during the active stage of labor that the pelvic floor stretches anywhere from 2 to 3 times its normal length, which is significant. If you even think about the length of, let's say, your bicep muscle, and then think of it 2 times longer, then 3 times longer, and that stretch has happened in a 24 to 48 hour period. It's quite dramatic what our bodies are able to do. So I see also women who have had pelvic floor weakness who have never had children. And that might be because they've had some constipation and they've chronically been straining. So with that strain, the pressure on the pelvic floor causes it to weaken a little bit. The same strain can happen if you gain weight or if your weight changes significantly. So one of the things that they've done a bit of research with is if you are doing some good pelvic floor exercises, as well as doing some general exercises and watching your caloric intake and lose a bit of weight, that can contribute even more to your pelvic floor working better, because it's not having to lift the same amount of weight. Pelvic floor weakness can result from menopause and changes in hormones. We know that pelvic floor muscle is quite hormone dependent. And we see that with women who still are menstruating, that they'll have times during their cycle that they'll tell me, I notice more incontinence, or I notice more symptoms of heaviness, just in advance of having my period. Okay. Chronic coughing can also put lots of pressure, and really just generalized weakness. So lack of exercise can too. So if we look at here, I'm going to go back. If we think about, a normal uterus, which is really tiny right in here, and then a uterus that, has a baby that's, let's say, maybe 8 months in gestation here, think about the additional amount of pressure that's on the pelvic floor. That's important because I have a lot of people that will say to me, well, I don't know what's wrong with my pelvic floor. I had a C-section, and so it should be fine. So, but that's one moment in time, that C-section. Most of those women have spent 8 to 9 months pregnant before it, of which there's been this really increased load on the muscle. As I mentioned a few seconds ago, that the changing in hormones when we go from pre to post menopause can greatly affect the way that pelvic floor is working. So we know that both estrogen and progesterone drop, and menopause, really, I think average age of menopause is just right around 52. And after that, then, some people may have been functioning quite well here and not really having any issues and been quite active and proactive about their exercise. And then all of a sudden they start noticing weakness uh, because they have some incontinence or prolapse. And that might be strictly due to those hormones. And then we also can see that pressure can be generated even when we don't have a baby. And that's what this little schematic is showing. And that is if we have chronic coughing, we have chronic asthma, things that impact the thoracic cavity also impact the abdominal and pelvic cavity. So increasing pressure here generates increased pressure on the pelvic floor. And we can see that people then sometimes develop pelvic floor weakness. So when we have, what this is showing is our bladder and a really nice strong pelvic floor here. So this is our urethral sphincter, and that's what we need to clamp. So when we cough, jump, sneeze, anything like that, it holds really nice and strongly, keeping the bladder closed. So you can't possibly leak when that's happening. In the case on the right, we have, again, our bladder, but we have weakness of the pelvic floor muscle. So as soon as we cough, jump, sneeze, anything like that, then a little bit leaks out because this clamp is just not quite effective. The other thing we see as pelvic floor physios, and that we find out in the internal exam, is that sometimes we have one side that works really well and one side that doesn't work so great. And I often say to my clients, like, you imagine that is like a garden hose. So you've got a garden hose, and then you have a clamp on one side that works really well, but the other doesn't. So you can have strength in places, but you do need symmetrical strength in order to make sure that that pelvic floor muscle works well. So here's just quickly showing different types of pelvic organ prolapse. So another sign of pelvic floor weakness. So if we look at the first one on the left, here's our pubic bone, tailbone at the back, our pelvic floor muscles strung from one to the other like that nice hammock, our anus, rectum, and GI tract, our vagina and uterus, and our urethra and bladder. So when everything is looking the way it should with the bladder should sit up nice and tall, almost like a triangle like this. And in this case, the bladder has tipped backwards and dropped down. So dropping down is prolapse. And what we notice then is a little bit of a bulge on the front wall of our vaginal canal. So that's bladder prolapse. If it comes from the back, that's rectal prolapse. So the rectum is pushing on the back wall of the vagina this time. Or we could have uterine prolapse, where instead of the uterus sitting up nice and tall here, it started to migrate down through the vagina. And we have different grades of prolapse, starting from a tiny little drop. If we look at this uterus, if it dropped here, let's say, that would be a grade 1. If it dropped to the vaginal opening, that would be a 2. If it drops down and through, that would be a 3. And if it drops all the way, that would be a 4. Let me just stop sharing and just make sure I'm not missing any. I can't see the chat when I'm in looking at my slides. All right. Everybody doing okay? Any questions at this point? Okay, we're going to keep going. So once we have a little bit of prolapse, what do we do about it? So for general pelvic floor weakness, some of the best things we can do are correct pelvic floor exercises. The research has been pretty outstanding about that if you see a pelvic health physio and do targeted pelvic floor exercises that meet your needs of enough intensity and enough duration, so enough on a daily basis, but over a weekly or monthly basis, that almost 80% of people have really good result. In fact, can cure the symptoms either of urinary incontinence or reduce the symptoms of pelvic organ prolapse. So that's pretty exciting for us as pelvic floor physios. And if you have been to myself or another pelvic floor physio, I mean, we do like our exercises. So really I've put here prescribed pelvic floor exercises, because we know when someone describes a Kegel or you read about a Kegel that it's not enough, that actually learning from someone that's giving you specific feedback goes a long way. We're also going to talk a little bit about biofeedback, vaginal weights, and pessaries. Okay. So just one more note on exercises, because I do like them. We know that we can increase the difficulty of exercises simply from going from lying to seated to standing. And in that way, our pelvic floor, which is an anti-gravity muscle, doesn't have to work as hard this way, right? Because it goes right to left. As soon as you sit, the pelvic floor has to go up and down and move against gravity. And as soon as you stand, the pelvic floor has to better support our core and our bodies as we stand. So it has to work even harder. So we can increase the intensity of pelvic floor exercises just by changing the positions, so the biomechanics. We can increase the load by using a weight, or in this case, a baby. And we can also make your pelvic floor work a little bit harder by increasing your respiration rate, because in that way, the pressure between the thorax and the abdomen is different and the pelvic floor has to work harder. And we know it works. The evidence is supportive of it. One of the other ways that we are using in the clinic is biofeedback. So this is an example using the PeriFit. So the PeriFit is a tool that helps give you better information about how your pelvic floor is working in terms of how it's contracting, but also in terms of how it's releasing. I have a number of women that are using it, and they very much like it because it gives them real-time feedback. So this little tool goes in the vaginal canal. It takes a reading of your superficial pelvic floor as well as your deep pelvic floor. And then on an app on your phone, you get to be this cute little butterfly, and you come up and down, trying to get these little things. It's like vaginal video games, okay? And as you get better at it, the intensity as well as the difficulty of the games increases. So that's one other neat way. So, the same way that we, go to the gym or at home, lift some weights to increase the strength of our muscles, we have vaginal weights. So once we know that your pelvic floor is working in the right way, and you're getting stronger, but maybe haven't reached your goals, then vaginal weights are a way to up the ante a little bit. So if we look at this little exercise system, this is one that we have in the clinic, but also can be purchased at Amazon and a few other places. So that white one weighs just about 1 ounce, all the way up to the dark purple one weighs about 4 ounces. And it really makes a difference. So if you're doing standing exercises and finding that your pelvic floor, you feel like you're getting stronger, then adding in a lighter weight in standing means that you have the feedback of the little weight, as well as you're working a little bit harder. The other thing that we have at the clinic are pessaries, and we fit women for pessaries. So if in this example, you have what happened before this little pessary was put in the vaginal canal. So this one looks very much like this one here. Is we would have had that the bladder was dropping back towards the front wall, and this person obviously was having a little bit of incontinence. So that little bump at the front helps to create closure of the urethra. So it does two things. It supports bladder prolapse, and it encourages continence. And so this is a fairly simple pessary to use. It goes up and in, and it's behind that pubic bone. And for many women, it does a really good job of helping support the prolapse, give better continence, and just better quality of life. So, and I think the other thing to note is, I mean, often people thought of pessaries as, that's last resort. Those are people that can't have surgery, that kind of stuff. But I wanted to say that I have many younger women starting to use pessaries, partly because it works, partly because it's kind of inexpensive. These things are just like $85 and only need to be purchased once. You can keep one for 5 to 6 years. And then what people use them for sometimes is support during a certain activity. So I have some women who love to run, and running for them brings on incontinence. And so what I say to them is, like, you would never go out for a run or a workout with potentially a sports bra on to support yourself. And so you can think of the pessary as a support, to support against incontinence and support against prolapse. Now, on the opposite end of that, I have much older clients who a pessary might go in, stay in for 3 months, and then they come back and see me. I remove it, clean it, put it back in. So they can be used in lots of different ways, all the way from people that are totally independent, put it in, take it out, clean it, do it on a daily, weekly, monthly basis, to those that need assistance with it in and out, okay? And they are used both for incontinence as well as prolapse. Okay, so now getting on to pelvic floor overactivity. So what we find in the clinic is more people have pelvic floor overactivity than you might think. And you can often figure it out when somebody is coming in and they start talking about pelvic pain, issues with constipation, issues with completely emptying their bladder, emptying their bowel, those kind of things, or urge, or lots of urgency. Men that have prostatitis, chronic pelvic pain, as well as urinary tract infections. So what is this? What is pelvic floor overactivity? So what we can think of, this is again a female model. So there's the bladder, there's the vagina, and the pelvic floor. So if we think about this pelvic floor, but really drawing both forward as well as together, because remember that pelvic floor slings around the vaginal canal, it slings around the opening of the urethra as well as the opening of the rectum. So if you picture a muscle that is very much contracting and holding and not releasing, that's what you want to think of when you think of overactive, or sometimes we call it hypertonic, just extra tone. So why does this happen? So it might be too much pelvic floor exercise. So I have seen a few women who were avid horseback riders, who did a ton of Pilates. So it might happen because of activity. It might actually happen too, just because people were going crazy with Kegel exercises when they already had a little bit of overactivity. Pregnancy itself can actually cause a little bit of overactivity too. And that seems, I know I mentioned it in the weakness example, but it can happen in terms of pregnancy too, because if you think about how muscles grow and strengthen, they strengthen because of load. And really what pregnancy is additional load on the pelvic floor. So if the muscle responds to that load by getting stronger, thicker, even a little shorter and tighter, then we go and have a baby, and now there's not as much load, then the muscle can get short, tight, and kind of stuck in the postnatal period. Pelvic surgeries and things that cause pelvic pain, like endometriosis, can cause overactivity. Emotional factors in themselves. So I often say to my clients that pelvic floor is a bit of an emotional muscle. So the same way that when we're stressed or emotional, our shoulders rise up and we get this tightness through our neck and upper trapezius up here, likely the pelvic floor is doing the same thing. It tends to kind of contract when we're nervous, scared, anxious, all of those things. It could be because of poor posture or really prolonged static postures. Painful sex can be another reason why it becomes overactive. So you could have one occurrence where, having sex and intercourse was not very comfortable. And then there's a little bit of angst about it the next time. Then you try the next time and it's worse, and it starts this really negative cycle. And infection can be the other reason, and partly because the muscle is and the tissue is not that healthy. It could be swollen, and then that could start this overactivity profile. So what kind of treatments can we do for overactive pelvic floors? So one of the easiest things that we often start with are simple lengthening exercises of the pelvic floor. So these exercises might be things that you're already doing, like child's pose, like cat-cow, some yoga positions that help to biomechanically lengthen the pelvic floor, and some really nice deep belly or diaphragmatic breathing. Over and above straight exercises, and this is a short list because of the amount of time we have, but there are a few things that we can use and are starting to use in the clinic because of pelvic floor overactivity. So TENS is one, and I'll go into that and explain what that means in a second. Just simply understanding pain and pain neurobiology is a big part of what we do when it comes to overactive pelvic floor. And then I'll talk a little bit more about radio frequency and how it is effective. To Kegel or not to Kegel. So if we find that the pelvic floor is actually overactive, so short, tight, not moving, stuck, you can think of it as stuck. If you have a muscle that's stuck and then you're constantly trying to make it contract more, we can actually make things a little bit worse. And that's why we advocate for people to come see a pelvic health physio, find out what's happening, and then really approach things in a very systematic way. Okay, TENS. So you might have heard of a TENS. It's a transcutaneous, so through the skin. It's not in the skin, but through the skin, electric nerve stimulator. So lots of times when I show this, people say, oh, that's like the Dr. Ho. It's similar in principle in that it uses electric stimulation. But Dr. Ho, the whole point is to get the muscle to contract underneath. This one uses a different type of electrical stimulation that it causes the nerve to be activated and not the muscle itself. So we're using TENS right now to relieve pain. And there's some good research to show that on the sacral area, like on the low back area, that using TENS can help to relieve pain caused by menstruation and also improve quality of life. So some of our clients that have fairly severe endometriosis and 3 days a month, they're out of commission. This is a good alternative. It's not medication. If it works, that's wonderful. And if it doesn't, there's no downside to it. I'm using it as well in children as well as adults that have issues with constipation. So when people get constipated, one of the things that happens is the rectum kind of gets stretched out because of the mass of poop that doesn't move from there or doesn't move in a hurry. And then the rectum, which is a muscle, doesn't contract in the way that it once did. There's some developing research to show that using the TENS, again in the sacral area, activates the sacral nerves, which cause rectal contraction, so that we can help decrease constipation, improving rectal activity. And then last but not least, that people are using TENS both in the sacral area as well as on the lower leg. On the lower leg, they're using it to decrease urgency and nighttime voiding frequency. So the same nerve that sends signals From the bladder up to the head is the sacral 3 nerve root. And down on the lower leg, the end of that tibial nerve, which is also on the sacral 3 nerve root, it can be stimulated to override some of those signals. And so for people that have lots of getting up all the time at night, this is a nice alternative to try anyway. So that's just showing a normal bladder and then a bladder that has urgency or overactivity. And essentially what's happening is the bladder contracts before we're really ready for it to. That's what overactive bladder is. So as I mentioned, there's lots of different treatments for overactive bladder, including, your fluid intake, including pelvic floor exercises, and then urge management strategies. But we're adding TENS to this list as a viable option because the research is building around it. So pain, just before I get to radio frequency, we're certainly having lots of discussions with clients about pain and about the whole neurobiology of pain. And what we know is that with increased understanding about why the pain occurs, sometimes people have less pain. And this in itself could be a full discussion. So I'm not going to discuss it too much more, but I'm happy to answer questions either now or in the future about the neurobiology of pain and about chronic pelvic pain, about any of those pain syndromes, okay? So radio frequency. So this is the newest thing that we have at the clinic. The one that I have is called the Temperature Vitalia. It's used in women's wellness. And what this is showing is the probe. So the probe has this little metal piece. It's about the size of, a thick pen. It's quite small. This goes into the vaginal canal, and this is the hand piece. So whoever's using it holds here, and it goes in that way. So how does radio frequency work? What radio frequency uses is sound waves, very high frequency sound waves that are low in temperature. So in that way, when the sound waves go into the tissue, they bounce around within the tissue and they create the opportunity for the tissue to change. So it heats it heats the tissue up below the skin. And as a result, it stimulates collagen formation. It stimulates that elastin to repair in a uniform way that has better quality. And it stimulates blood flow. And so physios have been using radio frequency for a long time to help with repair of tissue for things like Achilles injury, lots of different things. And now we have the opportunity to use it vaginally. So on the right here, what you can see is a uterus and vaginal canal. On the left-hand side is a vaginal canal that is quite healthy, has all these little rugae. Those rugae are important for mucosal lining. And you can also see, if we look at a cross-section of that vaginal canal, it's quite thick. So this purple is indicating the mucosa. The pink is indicating the vaginal lining itself, and lots of blood flow through there. So that helps with the sensibility of the vaginal canal. It helps with lubrication of the vaginal canal and all of those things. What can happen sometimes in both the postnatal and the postmenopausal period is that the vaginal lining becomes much thinner. So you can see the size of that purple mucosal lining here is quite a bit thinner than the one on the left. You see that we lose those nice rugae, that the whole lining, if you take the whole thing, it becomes thinner and we get a lot less blood flow. So then the tissue is a bit more frail, for lack of a better word. It doesn't stretch as well. It doesn't lubricate as well. And so one of the things that this radio frequency has been shown to do is improve that tissue integrity. So Going along with improving tissue integrity, the in using that radio frequency, what the research is showing, and the research is new and continually coming out, but making the tissue healthier means that we get increased lactobacillus counts. So lactobacilli are that healthy bacteria that help to prevent against UTIs. What we find in both the postnatal and the postmenopausal period is we get declines in these, and then the more unhealthy bacteria can live in greater numbers, which puts us at higher risk for urinary tract infections. Increasing lactobacilli counts also help to decrease the vaginal pH, which is good. We want that decrease in vaginal pH, which tends to go up, certainly in the postnatal and definitely in the postmenopausal period. It helps to improve vaginal wall integrity, improve urinary control. So once the tissue of the vaginal area is working better, then it's a bit plumper, it contracts better, and then we see that people are better able to control their continence. We also see that there's decreased pain, and the other group of people that would benefit from things like this radio frequency treatment are people that have had any kind of chemotherapy or radiation. So some of my clients who have had breast cancer and now are on tamoxifen, one of the things is it really it decreases the distensibility of the tissue of the vaginal canal, and it decreases the ability of that vaginal canal to lubricate. So then there's pain, and often pain with sex. And so this radio frequency treatment helps to reverse that so that there's decreased pain. And then we know that when there's better blood flow, better mucosal lining, better movement of the tissue, then we have improved sensation. So not just decrease pain, but potentially increase pleasure too. Okay, so this is me. I'm Kristen Parise. All my information can be found as well on the Blueberry Therapy website. And I'm happy at this point to take some questions. So I've left about 15 minutes for questions, and I can unmute everybody if you want, or you can unmute and ask a question, or jump onto the chat if you have anything that's come up over the course of the talk. I'm gonna have a quick drink. I'm parched. This is amazing. I answered every question. One of the things that we are finding at the clinic is that we are seeing lots more people that have a little bit of overactivity. And then once we kind of get through that, we uncover a little bit of pelvic floor weakness. So that's why I decided to kind of divide the talk up into the two sections, because for many clients, we're kind of doing one and then the other. And all of those options may be available to you or may be useful to you. So biofeedback, vaginal weights, potentially pessaries, TENS, radio frequency, all that kind of fun stuff. Okay. Well, I left a bit of time for questions. If you want, I certainly am happy to hang around a little bit longer if you have questions, or I can be reached at any of those contacts, either through the Blueberry Therapy at Gmail email, through the clinic phone number. And the other thing that we have are 15-minute virtual free talks. So if you had some questions that weren't answered today, feel free to book one of those, and we can have a bit more discussion that in that way is a little bit more private too, if that suits you better. Okay. Well, thank you very much, everyone, for coming today. And I'm excited because we have 3 more weeks of these every Tuesday from 8 to 9. Next week, Dr. Carly King is talking about fertility. She's an amazing naturopath here in Dundas who does great work in women's health. And then the following Tuesday is Jessica Hill, who's an amazing yoga instructor, hypnotherapist, instructor. And she's going to talk about how to have an amazing birth. And last but certainly not least is Dr. Allison Shea. She's a local OBGYN who has great information about menopause, as well as menopause and pain with sex. And so love to see you at the rest of those or the ones that really speak to you. All right. Good night, everyone.